So I've been posting a lot lately about NAD and what it does, and a lot of you have been asking questions, so I wanted to answer a few of those questions one by one. So our levels of NAD peak at the age of 20. So the most amount of production that you're going to be making at a high level is at age 20. After 20 years old, your levels start decreasing little by little bit. So by the time you're 40 to 50 years old, you have already decreased your production by 40 to 50%. So at what age should you start taking NAD? Well, typically around mid-20s, even 30s, you can start taking a small amounts levels of NAD. Now, if you're in your 40s or 50s, your levels of NAD are different, so dosing depends on your age and any other factors. There's no restriction on how long you can be on NAD. It just all depends on what you're using it for. Is it for anti-aging? If you're fighting off any type of illness, any degenerative disease, something like that, then you can be on it more long term. If it's something for anti-aging, preventative, then the way that I recommend it to my clients is you can do a cycle on and a cycle off. So if you're getting a certain dose in a certain amount of months, you can finish that dose and then you could take 1 or 2 months off depending on how high of a dosage you got, and then take a cycle off. In terms of using NAD while pregnant or breastfeeding, there's not enough data on it. So typically we recommend against it. It's best to wait after pregnancy or after breastfeeding to start out on your NAD supplement. But always consult with your primary physician. If you're on the spectrum, NAD can actually help you. Remember, NAD helps at a cellular level and can improve cognitive function. But always consult with your primary physician. The dosage can depend from person to person. So typically, a person can take between 100 to 250 milligrams throughout the week. Now, everyone is different on how their bodies can absorb it. So I always recommend you can start with a low dose, microdosing, and then you can work your way up to the 250 milligrams. Personally, I do 100 milligrams a week, and I do cycles between 2 to 3 months, giving me a total of 1,000 milligrams. If you have any more questions regarding NAD, comment below and we can answer those questions as soon as we can.